We know that clinical data and claims data are retrospective. They tell us what the past has looked like for an individual patient or a population as a whole. What we have found, and when I was doing population health work, really in the early days of after the Affordable Care Act came out, what we found is that the most predictive data that we had was not claims or clinical data. It was, in fact, what we now call social determinants of health. At the time, we didn't have that term, but we really were driving towards really what any nurse, ER nurse, could tell you when a patient walked in the door, whether they were going to be, a readmission or not, whether they were going to follow the protocols, all those things that people know when they've been in clinical practice for a long time and can identify. So those are the predictive factors, and I think, if you are dependent on an hourly wage earner to get to your next doctor's appointment, you're probably not going to go to the next doctor's appointment. If you don't have a working hot water heater in your home, you're probably not going to follow the dietary recommendations being made. And so there are lots of things that we now can utilize and leverage in order to both predict but also impact those outcomes in a different way.